menopause is a time when women are forced to look after themselves. So the big advice that I have for women in menopause, that they really need to look at their own needs, and it's a time to look after yourself. That means sleeping enough, hydrating enough, getting enough water, eating whole foods. I know there are many women out there who are busy at their work, busy looking after their children, busy looking after their husbands or their partners, busy looking after everybody else. So in the end, they may run through their life not having anything to eat, not drinking anything, being sleep deprived so that they can fold the laundry, so that they can make the beds, so that they can look after everybody else. But the only person that really suffers is themselves. And in the long run, all the people around them suffer, because women are nurturers. And in menopause is a time where your body forces you to look at yourself and take care of yourself. And in menopause, really, it's not a separate condition that occurs quickly in the period of a year. It's how you've looked after yourself right from the beginning of your reproductive years until you stop your cycles that really matters. And I find that anything you can do to decrease your stress levels, stress has a direct predictor on how you're going to go through your menopause, because adrenal function or dysfunction is really the biggest predictor of menopausal symptoms. So treating your adrenals in a very good way, treating them nicely, is a good thing to do. And that really means trying to set your boundaries and stopping work and leaving it at work, and giving yourself some time and doing things like having those nice warm baths and going to sleep early and reading a book and having time for yourself. But also you can use combinations that support the adrenal glands as well. Adrenals need lots of vitamin C. They need all the B vitamins. They need zinc. They need selenium. And there's lots of good adrenal herbs as well, like Siberian ginseng, ashwagandha, herbs that help to calm down the nervous system. There's lots of them out there. So passion flower and linden and chamomile and melissa, or lemon balm is another name for them. Those kind of relaxing herbals, even as teas, are really nice to take in. Having enough essential fatty acids, so plant oils like Udo's oil are really good for you. Having some fish oils to support your central nervous system or your brain function is really good. Taking in frequent meals, small amounts of foods and snacks really stabilizes your insulin levels. Making sure that you're getting your deep leafy greens and seaweeds are really helpful in increasing the amount of iodine, so jumpstarts your metabolism or your thyroid to make sure that you're staying nice and slim and your energy is really good. Those are all really important things to do in menopause. A lot of things in menopause are not really related directly to estrogen and progesterone production, but are more related to all the other hormone balancing organs to keep you balanced. And then going back to even more basics, it's the stuff we talked about earlier, looking after the digestive tract, keeping the liver happy, because all your hormones are changed and metabolized and activated in your liver. So if your liver is not happy, then you're not going to have good hormonal balance. There's 3 main estrogens that the body produces in the liver. Estrone is the bad one that causes inflammation, that's higher in breast cancer, that's higher in cervical cancer, all the cancers related to women's issues, estrone is high. Estradiol is the one that's the highest in our body and is kind of a neutral one, has some protective effects. And estriol is E3, and that's the one that has been the most protective. So you can actually convert E1 to E2 and E3 by supporting your liver. Again, by the use of fluorescence, by the use of optigreens, by the use of foods that actually decrease inflammation in the body. So it's a really simple process. You can actually change your own hormonal balance by looking after your primary elimination organs.